softness of the second heart sound, loud second heart sound, absent second heart sound. We talked about the delay A2 component, delay P2 component, or also we talked about the splitting of the second heart sound, and we also talked about the reverse splitting of the second heart sound. These are the peculiarities that can come up in case of second heart sound. Now, physiologically, you may not hear the third and fourth heart sound, or some situations we can see in case of children, young adults, athletes, where the rapid filling is more. Now, remember, this is occurring because of protodiastolic sound or ventricular gallop, initial passive filling of the ventricles. This is because of negative pressure, और फर्स्ट रैपिड फिलिंग, बिकॉज वेंट्रिकुलर डायस्टोल में दो रैपिड फिलिंग है, फर्स्ट रैपिड फिलिंग एंड सेकेंड रैपिड फिलिंग. फर्स्ट रैपिड फिलिंग इज पैसिव because of negative ventricular pressure. Ventricle starts dilating, that produces third heart sound. So this is produced in some children, in young adults where the cardiac flow is more, cardiac output is more. That time we can see athletes, pregnant women, we can also find this kind of third heart sound. Physiologically we can find. Again, pregnant women, because cardiac output is more. Then the blood flow going through the ventricles is also more, and that produces third heart sound. Produces third heart sound. You can also see a pathologically present third heart sound. Pathologically present third heart. Causes of pathological third heart sound, if you can see. Pathological third heart sound produced because of high output states. Let's say, for example, severe anemia, VSD, ASD, PDA. In those cases, left ventricular का pressure is more. Congenital heart disease, hypertrophic cardiomyopathy, ischemic heart disease, constrictive pericarditis. In all these situations, there may be more cardiac output. There may be more dynamic circulation, more hyperdynamic circulation. In those cases, you may see third heart sound coming off pathological. You may also see some differentiating feature between right and left